and thank you for joining us for our Thursday, April 23rd, 2020 briefing. With us today, along with Commissioner Josh Slotnick, all the way from over in Missoula County, across the street under most circumstances. We have Grace Decker from Missoula's United Way 0 to 5 Strategic Collaboration Coordinator, and Anna Semple, who works at our City County Health Department coordinating our Healthy Start program. Both great advocates for kiddos and families, and we're glad to have them here today. As a function of COVID-19, childcare, which has been an issue, really became an emergent issue and something that the community not only was working hard to address, but has had to work sort of doubly hard to sort things out while we're trying to help folks stay at work, go to work, stay home in some cases, all of it. So it's pretty complicated. And maybe the two of you could just start us out by telling us what you've been up to.
Thanks, John. Yeah, I'm happy to. And thanks for having us here to talk about this work and childcare a little bit. We, as the coronavirus pandemic started to come into Missoula, we realized that childcare might become a reason why critical healthcare workers might need to stay home. And so from the beginning, the Emergency Childcare Task Force was really focused on trying to make sure that that did not happen, so that childcare wasn't a reason why our community might be at more risk of tragic consequences to the crisis. So we focused from the beginning on the idea of trying to make sure that we had enough childcare in operation to serve the needs of folks who work at the hospitals and who work for those critical occupations like first responders and police and fire. And so we did some assessment around that. We brought a task force together with folks from the public health department, from the school district, from Child Care Resources, who handles a lot of child care needs in our community. And then also we worked really closely with the Boys and Girls Club and YMCA to understand what the need was and get ready to establish emergency childcare.
That's great. Thanks. So how have childcare businesses been affected as businesses?
Anna, you want to take that one?
Yeah, I think it's affected all of them differently. So some of them have stayed open. It's estimated about 80 childcare facilities are still open today. Some of them closed when the schools closed because of the concern for bringing children together. And all of the facilities that remain open have adjusted their model in order to encourage best practices as recommended by the CDC, by the state, and by our health department. So they are doing different drop-off and pickup routines. They have fewer people in a space, so basically 4 kids to 1 adult and maybe up to 10 people in a room, which is way smaller than the general ratio of how they operate, which is a lot more expensive for them, often operating at a loss. So it's been economically hard on both the facilities that are open as well as obviously the ones that are closed.
Yeah, and so really one of our goals as we started to understand this situation was to make sure that we were directing people in the community to the childcare options that existed, including already licensed childcare providers who really are trained and experienced at providing care to children in the community. Because for some of those programs, they have openings that they wouldn't normally have. Because they're continuing to only serve children of essential workers by the governor's definition. And we also wanted to direct people, especially those who had school-age kids, to businesses that had set up the emergency childcare, so the Boys and Girls Club and the YMCA. Mm-hmm. Really wanted to make sure that we understood what the needs of those childcare businesses were, because the last thing we want to do is roll out of the crisis with fewer childcare businesses operating than we had when it started.
Mm-hmm.
That's great. So what Josh and I have certainly learned, if we didn't know it before, is that more heads are better than one in trying to solve problems. And so you all have been working with the Incident Command Team and COAD trying to sort this out. Who else has been working with you?
Go for it, Grace.
Okay, well, I mentioned a couple of them, I guess, a minute ago, but, you know, Anna and the Public Health Department, City County Public Health Department have been really critical partners in keeping us informed of the changing situation. So we also have had the involvement of an environmental health specialist, Emily Andrea from City County Health Department, who's able to take a look at possible locations for emergency childcare and also able to really quickly answer questions that providers of emergency care have about the changing recommendations for health protocols. How do you check children in? What's the best way to do drop-off? How should we be sanitizing? Should we be wearing masks? Lots of different questions that have come up. We've also had folks from Childcare Resources involved, and of course, Childcare Resources is the organization that does referral to open childcare spaces on a regular basis and also handles financial assistance for childcare. And so they've made their own scholarship fund, the Hand Up Fund, available to offset some of the cost of attending childcare during this time for families who need help. So they've been a really critical partner. We're also working with folks from the Missoula Interfaith Collaborative to understand what's going on around community organizing and understand what people are saying on the ground about their need. And then from the beginning, we've also been connecting with and having on our calls folks from both Community Medical Center and from St. Patrick Hospital who can give us that really direct and of course changing all the time perspective on what the demand is really going to be for emergency childcare among the critical healthcare workforce.
Thank you.
Yeah, that's really good. So you guys, what do you feel like you want to make sure parents know right now around childcare issues? This is a pretty intense time to have a small child.
Yeah.
No doubt. Yeah.
To two parents, yeah.
Me
I
too.
know
They're just
that,
big.
yeah. I think it depends. Every parent is in a different boat right now. So a lot of parents are at home with their children, and that's partially why childcare facilities have extra openings. And parents that are at home, I think just patience with yourself and self-care is the thing that we are emphasizing over and over again. This is hard for everyone. You are basically doing likely a full-time job at home and caring for a child full-time at the same time, and that childcare is a profession for a reason. It's a very difficult profession, and to add that to your workload every day, you have to be patient with yourself because it's not going to be easy. And so we are just recommending that people take time for themselves, connect with people distantly in whatever way you're able to, and to really look for those ways to help yourself stay centered and grounded so that you can be there for your child in the way that you want to be, and that you can be under normal circumstances, right? I think people that are sending their kids to childcare, I think just talking with your provider about what they're doing to keep your kids safe and understanding what is going on their end of this as well, because it is a whole, providers are making massive changes and being extremely flexible to make this work as well. So just kind of understanding and having that conversation. Mm-hmm. Grace, do you have anything to add to that?
Yeah, I would say that people should, in addition to those pieces which are really the most important messages for people to hear, if you're someone who is looking for childcare right now, because you do need to be at work, and there will likely be more and more people who will be looking for childcare as people are returning to work. You should know that the YMCA and Boys and Girls Club are operating childcare from, I believe, as early as 6:30 in the morning until about 7 o'clock at night. And that's true for children 0 to 5 as well as school-age children. And that there's financial assistance available for those programs to keep the cost quite low. Those are open to people in those essential occupations. And we also have available through those programs, and we're getting ready to open more should it still become necessary if we see kind of a rolling nature to this crisis. We have childcare that is specifically for those healthcare and medical professionals, so that population has a little bit of extra assurance around that. And that's, again, through the YMCA and Boys and Girls Club. And for people who are looking for childcare in the short term as well, and maybe your childcare provider has closed, Childcare Resources can direct you to facilities that are willing to enroll new children under these very controlled circumstances, and there's financial assistance available there too. So we want to make sure that people know that there is childcare available if you do need to use it, and that there's financial assistance available. So contact either Childcare Resources or the Boys and Girls Club and Y directly.
That's great.
Thank you.
So we are, Governor just issued a phased plan for reopening. We're still digesting that, but that's going to change the landscape a little bit. And I think all of the resources that you just mentioned are going to be critical to those folks as they sort of navigate. Am I going back to work? Am I still working from home for a variety of reasons, et cetera? So thank you for that. And at the end of this video, we'll have some of those resources up there in writing so that you don't have to scramble to make notes. Commissioner, you get the final question today.
All right. You know, children pull at the heartstrings of all of us. People want to help. What would you like to have them do?
There are a couple things people can do to help. First, childcare is expensive under normal circumstances, and the kind of childcare that's being provided now for a variety of reasons is more expensive to provide. The group sizes have to be smaller, and we also need to be paying providers a little bit more to recognize that this is a little bit more hazardous work for them. And so if people want to make a donation to support the cost of childcare, they can do that by donating to the YMCA or Boys and Girls Club directly. Just contact them, or Childcare Resources, and you can donate directly to that scholarship fund to help parents pay for childcare. And then if people want to do something that's more direct, of course, we're not encouraging people still at this point to get together socially to take care of each other's kids, but people can help take care of parents. And so I'd encourage people, if you know someone who is home with young kids, to reach out to them, ask how they're doing, how it's going. That sometimes someone to listen to you while you say what a hard day it was is the best way that we can support each other as a community of parents and as a community of people who care.
That's a great answer. Thank you. Thanks both to you guys.
Yes, thank you both. Thanks.
Yeah.
Turns out if we take care of kids, we end up with good humans. So thank you for the work you're doing on the front, and we're very grateful to you. And thanks for your time today. And keep safe and keep healthy.
Thank you so much for having us.
Thank you.
Talk to you soon.